Hello friends, welcome to my channel. My name is Abhirami and I am here to discuss with you about hyperplasia. Hyperplasia is the increase in the number of cells in the tissue which leads to increased size and mass of the tissue. The cells can be either differentiated matured cells or less differentiated progenitor cells. Now, how does the hyperplasia happen? What is the mechanism behind it? The mechanism is that when there is an injury in the body, the growth signal arrives at that place and the cells in that area starts dividing. So normally the body should stop the growth signal after the injury is healed. But this does not happen. Instead, the growth signals continue and the cells also keep proliferating, and this leads to increased tissue size and mass, and this is called hyperplasia. Now going to the next slide, you can see various types of cellular adaptations here like atrophy, hyperplasia, hypertrophy, dysplasia and metaplasia. Here we are only talking about hyperplasia today, and hyperplasia is nothing but increase in the number of cells of the same size. Now going to the next slide, what are the causes for hyperplasia? The causes can be either physiological or pathological. So physiological causes are of two types again, that is it can be because of hormone or it can be because of compensatory hyperplasia. So how can hormones cause hyperplasia? So one of the best example is the glandular epithelium development in the breast. During puberty, pregnancy and lactation, the breast will enlarge. So this is the best example, and also during pregnancy the uterus will also enlarge. This is also an example for hormonal hyperplasia. This is because of the action of estrogen. Then what is the example for compensatory hyperplasia? So when there is a partial hepatectomy, the liver starts growing by compensatory hyperplasia, and this increases the effective functioning of the liver. Now going to the pathological causes for hyperplasia, the pathological causes are again excessive production of the hormones and chronic irritation or injury. So how can excessive production of hormones cause hyperplasia? So one of the best examples for pathological hyperplasia is benign prostatic hypertrophy. This is because the androgens are produced more and more, excess androgens are produced, which leads to prostatic hypertrophy. And also this can also happen in the endometrium because of excess production of estrogen. The endometrium can also undergo hypertrophy, so endometrial hypertrophy can also be there. And in patients with cirrhosis, estrogen therapy is adopted, and if they have estrogen therapy, then what happens is in male patients there is development of breasts. This is called gynecomastia. So this can also be an example of pathological hyperplasia. Pathological hyperplasia can also occur because of chronic injury or inflammation. So how does this happen? When there is a chronic injury that does not get healed, inflammation takes place there, and this leads to increased production of cells in there, and this leads to hyperplasia, especially in the skin or in the oral mucosa, and this is about the pathological hyperplasia. In the next picture you can see an example of pathological hyperplasia. Like what happens is there is a normal bladder and a normal prostate, but then after hyperplasia, because of excess production of androgens, there is a hypertrophy of the bladder and the hypertrophy of prostate. This is called benign prostatic hyperplasia. Now what is the risk of hyperplasia? Pathological hyperplasia. Pathological hyperplasia can lead to cancer. So that is why pathological hyperplasia is very risky. It can soon develop into cancer. For example, endometrial hyperplasia can become endometrial cancer. So that is it about hyperplasia. If you like this video, please like, share, subscribe and comment on it. And if you have doubt, you can post it on the comments below. Thank you.